everyone, my name is Dr. Baptiste and I'll be delivering a talk today, a talk that will hopefully provide you with real insight into a career in general practice. I work as a portfolio GP, but I'll talk about what that means in a moment. I'm going to be sharing my slides with you today, so I hope you find the presentation very useful, and if you have any questions, then please email the organisers and I will endeavour to respond to your queries. So this is my presentation. I hope that, like I said, you find it useful and it provides you with a really useful insight into a career in general practice. So let's talk about who I am to give you a bit of background and context. So like I said, I am a portfolio GP. I studied at UCL Medical School. I qualified in 2013, and then I went on to complete my foundation years. That's 2 years working in the NHS. Then I took some time out of training. I took a year out of training for a number of reasons, and then I embarked on a career in general practice. So the training program is about 3 years. It can be 4 years, depending on what the program you choose. But the standard length, the standard program is 3 years. I also write for GP Online, and I also work for the General Medical Council, the GMC, as a PLAB examiner. I also examine medical students, and I also teach medical students as a GP tutor at my previous practice. I have given a number of talks throughout the years. One of my keynote talks was at the BMJ Live Careers Fair, which is an annual fair for clinicians, for medical professionals. And I'm also a school speaker. So I will speak to schools about a career in general practice and in medicine. I'm also the founder of a membership program called Med School Extra, and this program is designed to support medical students on their medical school journey and beyond. So that's a bit about me. I'm now going to talk about a typical kind of day in the life before the pandemic. I feel that is important just so that you can understand how things were slightly different. So typical day for me, I would arrive at work at around 8 o'clock in the morning because I like to prepare early and plan early. My clinic doesn't actually start until 8:30, but I like to have about half an hour or 20 minutes or even 15 minutes just to check some of the queries, maybe from the last day, the previous day that I was at work, and I will be giving administrative duties. So I will be giving admin that I'll have to go through throughout the day. So that's what I would spend some of my morning doing. So that might be some results of blood tests or imaging results. So my clinic will start at 8:30. It could go on to about 12 o'clock, but it generally is about 3 to 4 hours. And then, like I've said, some cases would include maybe some medical certificates. So maybe a patient might not be fit enough to work. Maybe they've got back pain and or they've had an injury, they've had a fractured wrist or something, and they're not able to perform their duties at work. And so we can sign them off, so to speak. Sometimes patients will come in with back pain, and so that might be managing their pain with medications, or they might need a referral to the physiotherapist to help with some back exercises. Might get a case of a UTI, a urinary tract infection. So the patient might come in saying, I've got pain passing urine. And then you might think, okay, this sounds like a urine infection. And then you might prescribe some antibiotics. You could also get a case of someone with a headache, in particular a migraine, which is a type of headache, which of course you may have heard of. And then it might be then treating the patient's head pain. Other things could be someone might talk about chest pain, and then you have to decide, do you think this is going to be a heart attack or is this going to be indigestion? If you do think it's a heart attack, then the patient needs to go to A&E as an emergency. And then during my lunch break, I will complete some paperwork, might have to go on a home visit and try and eat some lunch. And then the afternoon clinic is much of the same, which would start at 3 o'clock and again would probably end around 6:30 or 7, thereabouts. And then I go home. So the other things that could happen during the day would be clinical meetings. The practice might have meetings where you have to discuss cases, things that have happened, audits, things like that. Teach medical students, there's designated time for that. And there could be teaching for us as GPs. Now the pandemic came about, and I do have a video. So I have a YouTube channel, which I didn't mention in the start of the presentation, but my YouTube channel is simply Dr. P Baptiste, and there is a video which I was planning to show you, but I don't know if there's time because that video is a little bit long. But basically the video talks through how things have changed for me in the pandemic and a day in the life of a GP. So if you want to head over to my YouTube channel, like I said, it's Dr. P Baptiste. You can watch that video there. Depending on how long the presentation is, I could play it for you at the end, but I think it will probably be better overall in terms of quality if you were to check that video out in your own time. So just again, touching on the pandemic, it's more kind of digital or remote working now. So the majority of what I do as a GP would involve telephone and occasionally video consultations, but I think those are very rare for me anyway. So yes, the majority of what I do will be telephone consultations. I mean, that has slightly changed for me because my job role has changed. So up until about a month ago, I was working as a salaried GP. So that means that I was employed by the practice and I would do 2.5 days a week, which would work out to be 5 sessions. So one session is a morning clinic or afternoon clinic, so about 4 hours. And so I would do that 5 sessions over 2.5 days. But then I decided, because of a number of reasons, which I do talk about on my YouTube channel, actually, if you're interested in knowing a bit more about that, I left and now I will be locuming. So I won't be employed by a practice, rather I will be self-employed. So that means that I kind of work around my existing schedule and commitments. So the hours vary, but I probably aim to do about 1 to 3 sessions per week. So in my new role, the majority of what I do is actually going to be email. So there is something called eConsult, which you can search for in Google, and it will tell you a bit more about what eConsults are. I do have a video called The Week in the Life of a GP, where I do talk about eConsults and what they mean and how they are incorporated in the work that we do as GPs. So if you want to know a bit more about eConsults, like I said, you can search in Google, but you can also check my video out, which I do talk about them in a bit more detail. So what I would do now is more email and telephone, and probably occasionally video consultations. SMS, so we can send text messages to patients to let them know something is ready for collection, like a prescription or a blood test form that they need to come and collect from the surgery. And like I said, I spoke about email and e-consults. So why should you consider general practice? So general practice is a short training program, and for many people, they may feel a bit uncomfortable with that, but actually there are many people who feel that, like myself, 3 years rotating in different specialties is perfect. At the end of your training, you will get a certificate, which shows that you are no longer a junior doctor, you are a GP. And I think with general practice, you have a really, really good work-life balance. If you do want to do additional work in the hours outside of a typical working day, which is about 8 to 6:30 p.m., so in the evenings and the weekends and the bank holidays, then you can do that as well as part of your role as a GP. So there are many options. Like I said, there are options. There are a lot of opportunities within and outside of general practice if you do decide to choose general practice as a career. And career autonomy, having control over your career and your decisions, which some people do find maybe a bit more difficult to do with hospital medicine. And yes, you have a very good salary. Depending on what you do and how much you put into the job, then yes, of course, you can have a satisfactory salary, a good salary. And like I said, there is a potential to earn more depending on how much you put into the job. And if you do check out my YouTube channel, I have a video which talks about how much GPs earn. Okay, so let's talk a bit about the clinical side of in general practice. So you can be an academic GP, which means that you will spend a proportion of your time involved in teaching and research, which many people enjoy. You can teach medical students, which is something I do, and GP trainees and colleagues, although you do have to undertake a qualification, a course to do that. You can become a GP with a specialist interest. So this means that you can then upskill in a particular area. So that could be cardiology or, the heart, to do with the heart. And this can actually supplement your role as a GP. If you're in a practice, you can run clinics with, seeing patients who have heart problems, diabetic patients. And it also provides an additional service to the practice and to your community. I've listed some examples below, and these are some of the diplomas that you can undertake to become a GP with specialist interest. And like I said, I have loads of videos on my channel, and one of those videos does talk about GPs with a specialist interest. So outside of general practice, you can work with a number of different organizations. You can work with the armed forces, the police, charities. You can become a medical legal advisor, which means that you'll have to upskill in the law and know about medical ethics, occupational medicine, which is all about the world of work and helping people if they have medical conditions and how that affects them and do their job. Outside, again, of general practice, you can become a forensic medical examiner. You can work on a cruise ship. And like I said earlier, you can work in the urgent care center in A&E. In terms of non-clinical roles, so that's not being in clinical practice, seeing patients in a clinical capacity, like examining, diagnosing, treating patients, you can work in politics, the media. I'm sure you may have heard of many doctors who are in the media. You can undertake medical writing if writing is something you're passionate about and that you're good at. I certainly do with my role as a writer at GP Online. Pharmaceuticals, and you can even become a careers coach for doctors or just a careers coach in general or a life coach. In terms of a portfolio career, which is what I have, it basically means that you spend some of your time in clinical practice and then some of your time doing other things, other careers, other interests. So you have multiple jobs or multiple employers within one or more professions. And this enables you to build up many different skills and have more control over your career and over your working week. So there are many GPs who do not work full-time, but they do work part-time as a GP, and then, like I said, pursue other careers and interests as above, like myself. So in terms of just to wrap up the presentation, my final thoughts would be that there are many aspects to a career, both positive and negative, and that when you're choosing a career or even a specialty within medicine, really try and do your research, speak to people, try and spend as much time as you can in that specialty. If you haven't been allocated a job or a post in that specialty, then maybe taking some time out of the training pathways and spending some more time in the specialty that you're interested in. Be open-minded. I personally did not think about general practice until I took my year out of training, in which I wasn't sure what I was going to do. But please don't shut other specialties down. Really just be open-minded throughout your career, throughout your training. And think about, how can you impact the lives of others and how can you do that well? In the hospital, I was very frustrated at times because I felt that I couldn't help patients in the way that I really wanted to because of time pressures, because of the structure, the way the hospital worked, because I always felt tired. I felt like I was always on call and I was just very pressured. So for me, I didn't feel that I could impact the lives of other people, of my patients, in the best way possible. So that's one of the reasons why I chose general practice. And think about, does this career suit your personality? Being a GP, you work very independently. And for me, since I've known myself, I have always been someone who has been very independent, someone who has always just gone on and just gone about their day and just got on with things, basically. So I've always been able to work as well as part of a team, but for me, one of my strengths lies in being independent. And certainly as a GP, you spend a lot of your time working alone, and certainly in my new role, being more of a remote GP, where I'm not physically in a practice and I do more emails and telephone calls, I am in a way on my own. There are of course people I can contact, but for me, I don't see it as working in isolation or working alone. I see it as just something that I'm used to doing and something that suits me and my personality. So Try and think about things that might match your personality and then go from there. And yes, the next point is really just understand the practical aspects of the career. Think about, yes, the career, the specialty or the job might seem exciting, but it's a bit different when you're actually working in that job, in that specialty. So it's difficult to know because you're obviously not in that job and you're not doing it day to day. But try and think about some of the other things like a work-life balance. When you start working, will you be 25? Will you be 30? Where do you hope to be when you're 30 years old in medicine and outside of medicine? So you're going to change. Things are going to happen to you as you go through life. That's just a normal part of life. Life events happen, good and bad. So it's important to think about the practical aspects and the non-clinical aspects to a career. And yes, like I said, where do you see yourself in 5, 10, 15 years? Is having a family important to you? How will you be able to balance a family and a particular specialty? So it's not just about that, but there are loads of other things to think about. And it's just important that you think for the future as much as you do for the immediate, the present and the immediate future, which is applying to medical school and working as a junior doctor. Think up a little bit further on if you possibly can. You may not want to, but I would advise you to do that. So that's all I'm going to talk about. I didn't want to make it a very long and drawn out presentation. I wanted to put some important salient points there. What I would say is, check out my YouTube channel. It's Dr. P. Baptiste, and it has pretty much 90% of the things you need to know about general practice. And there are some videos about applying to medical school, and there are some videos about the financial aspects to being a doctor, which medics often don't seem to talk about. So I hope you enjoyed the presentation. Like I said, if you do have any questions about anything at all related to general practice or related to just being a doctor and a career in medicine, then please email the organizers and I'm happy to respond to your questions at a later date. So yes, I hope you enjoy the rest of your day and take care.